And get started with our first group.
Thank you. My name is Holly Pager. I'm the program director for the University of Cincinnati. I'm also here with Ashley Bolger, who is the program director for the combined program Pediatrics and PM&R. We put together a few slides, so let me just pull that up here. It's saying I can't share.
Sorry, I just fixed that. You should be good to go now.
Thanks. All right. So thanks, PM&R scholars. This is great. I really think it's excellent that you've put all of this together and allowed all of us to kind of introduce ourselves. So we're the University of Cincinnati. You know, a lot of people kind of wonder why Cincinnati. I always tell applicants and students that I'm not from Cincinnati. I grew up in Colorado, and after undergraduate in Colorado, I moved to Washington, D.C., and then I did my residency in Arizona and my residency in Chicago. So I have no ties to Cincinnati at all. My husband and I moved here after residency, and we have really grown to love it. It's a really fun city, a really great place to live. A lot of places, it has been named on the US News as one of the top 50 places to live in 2019. It's one of the top safest cities. It's really fun for young people. I have 2 young girls, and we take them out when it isn't a pandemic and go to the zoo and lots of museums and lots of fun things to do. A lot of professional sports teams, as well as a professional soccer team, which is pretty cool. So it's a fun city. Lots of great restaurants and bars too, which I think I was pretty surprised about actually when I first moved here. These are our current group of residents. They are our greatest resource, definitely. So the UC College of Medicine, here, one second. Fix my screen here, sorry. Was established in 1819, so it's one of the 8th oldest. It is the 8th oldest actually in the US. We have 56 accredited residency and fellowship programs and 690 current residents and fellows. So it's a pretty big university. UC Health is Cincinnati's only academic medical center. It's comprised of UCMC, Westchester Hospital, Daniel Drake Hospital, for Center for Post-Acute Care, which is where we have our inpatient rehab facility and our skilled nursing facility. And the UC Gardner Neuroscience Institute is actually our first, it was recently built in April 2019, and I'll be talking about that shortly, but University Medical Center was established in 1823, and so I think it was the country's first teaching hospital actually. And then the Drake Center was established in 1851, so it's also fairly been around for a fairly long time. It is the region's only level 1 trauma center, and we have more than 1 million patient encounters annually. So the Gardner Neuroscience Institute, it is basically the home for multidisciplinary neurologic care. So it opened in April of 2019. It's a brand new 114,000 square foot building. It encompasses 15 specialties, which includes PM&R, and there are currently 67 active and future clinical trials for neurologic conditions ongoing. The goal of this institute is to create multidisciplinary care. So there is a spine center that includes the neurosurgeons and the physiatrists and the neurologists all in one area. This is just a photo of the building. So about our residency program, it was established in 1988. It is categorical, so you would do your intern year here as well. This, I think, has an added benefit of getting to know your colleagues in internal medicine and some of the other attending physicians in the other specialties. We accept 3 residents per year for the adult PM&R program, and then Dr. Bolger will talk about the combined program or the triple board program where she accepts 1 per year. Clinical sites include UCMC, the Drake Center, which I mentioned, UCGNI, and a couple other locations nearby, and CCHMC, which is Cincinnati Children's Hospital, and the VA as well. Our residents do take home call. It is a Friday to a Friday. They switch typically on Friday morning and are holding the call pager throughout the week. So some of the program highlights, we do have protected didactic time. So on Thursday mornings, we have our didactics. It usually starts around 7 or 8 and ends around 11 or 12, just depending on how many lectures we have scheduled. This is a mix, I'd say, of faculty and residents and outside speakers as well. Our residents also have a continuity clinic, which I think is pretty unique to the University of Cincinnati. So as a PGY2, they are given the opportunity to pick a clinic of their choice. So if they are interested in pediatrics or interested in sports medicine or interested in neuro rehab, they can pick that clinic and kind of do their a trial of a continuity clinic for their PGY2 year. And then for their PGY3 and 4 year, they are in a clinic where they have their own patients and do their own billing and see them for the next 2 years. We do have a sports medicine trained physician. He is actually our associate program director, and he covers high school sports, university, the Miami University, and the Cincinnati Cyclones, in addition to the marathon coverage and things like that. So lots of opportunities for sports coverage. We have implemented a pretty robust wellness curriculum. We have quarterly, we have a wellness meeting with our residents, and then biannually we do an outing of some sort, and then once a year we have a wellness retreat. And that the retreat is a full day off-site event for the residents. It's usually in the fall. This year we've had to postpone because of coronavirus, but hopefully we'll be doing it in the spring. Our residents ask that I mention this, and I think it's really important that because we are a small program, where it's pretty customizable. So if you are interested in doing electives earlier on in your residency training, you can be pretty flexible with a lot of things. Vacations, et cetera, you don't need to find coverage for because it is small, so the attendings just cover. Clinical rotations. So for your intern year, you're with internal medicine. 6 months of IM, a month of neurology, a month in the neuro ICU, rheumatology, ortho, and neurology. And then we do have 1 month of PM&R consults as a PGY1. And then for PGY 2, 3, and 4, you can see it here. I don't need to read all of this out, but basically we kind of do most of our inpatient rehab months as a PGY2, and then less as we advance through the years. So 6 months as a 2, and then 3 as a 3, and then 2 as a 4. And actually we're switching to 13 4-week blocks. So this will add up to 13 blocks, but and then as you progress through the years, you do more outpatient rotations. So the VA is that's an outpatient rotation. MSK is outpatient. Peds, obviously, you do 1 inpatient as a 3, and then an outpatient as a 4, and then a lot of elective time as well. Children's Hospital, I'll let Dr. Bolger talk a little bit more about this, but it is a highlight for both of our programs. So it's ranked number, kind of hovers between 2 and 3, I guess. Best Children's Hospital in U.S. News and World Report. It's the largest pediatric rehab division in the country. So if you're interested in peds rehab, this is a great place to go. And for the adult PM&R residents, we do rotate over there, and we do 1 month of inpatient and 1 month of outpatient over there. For the VA, this is all outpatient. You do EMGs, and then there are outpatient clinics for spinal cord injury, brain injury, and prosthetics and orthotics. So I mentioned our didactics. They basically they're comprised of, there's an intro lecture series, and then throughout the year we have monthly EMG and MSK conferences, journal clubs, and then outside of our just regular didactics, there is a biannual ultrasound course. So one of them is upper extremity and one of them is lower extremity. We do gross anatomy as well, and that's part of our weekly didactics. Usually that's in November or so, after the medical students have completed their gross anatomy. And then pediatric rehab lectures when you're on your pediatric rotations, and there is every other year there is a regional pediatric rehab symposium that is an opportunity for our residents as well. Research is strongly encouraged. We do offer conference travel for research that's accepted to national conferences. And we also host annually a resident research day, in which all residents are encouraged to present any research they have done throughout the year. And we have one faculty member on the adult side that has a motor recovery lab and has been working with a lot of our residents in his lab. And then we have several faculty on the peds side also that do a bunch of research. Teaching is strongly encouraged as well. We have a couple opportunities for our residents with medical students. There's a ultrasound curriculum for the medical students that the PM&R residents and faculty participate in. We teach the MSK ultrasound, and usually it's the wrist, and our residents participate in that. There's also a MSK clinical skills lab for the medical students, first year medical students, that our residents teach those clinical skills. Again, our ultrasound symposium, which is 2 half-days per year, and typically our senior residents who are interested in ultrasound will actually help teach this at this symposium as well. And then we have both 3rd and 4th year medical students on our inpatient and consult rotations. And all of our PGY3s and PGY4s will present a grand rounds. As far as placement, it's kind of scattered, I would say. We go both academic and private, and kind of mixed between neuro and MSK, peds, as you can see in this pie graph. We have, every year we have a spinal cord expo. It's our big volunteer event for our patients in the community with spinal cord injuries. We invite several vendors there. We usually have a guest speaker. There's usually a wheelchair basketball game. It's always a lot of fun. And we do other things outside of work as well. And when it's not pandemic, we do fun things like sand volleyball. Our program coordinator, Mary Duke, has a lake house that she invites all of the residents to every year. So I'm going to hand it over to Dr. Bolger to talk about the triple board program.
Thanks, Dr. Pager. Hi guys, I'm Ashley Bolger. Like Dr. Pager said, I'm the program director for our triple board program, which basically means that we take 1 resident a year who will do 2 residencies combined into 1 and be eligible to sit for 3 board exams at the end. So they're able to sit for the pediatrics board exam, the physical medicine and rehab board exam, and then the pediatric rehab medicine subspecialty certificate. So we're one of 3 programs in the country that has this setup. So we are kind of a unique small entity It is a little different than the fellowship in the sense that you will do all of the rotations in terms of like pediatrics that a peds resident would do. So things like, you know, your inpatient HEMONC and GI and PICU and NICU and all of those things are encompassed in that. It's a 5-year program. Your first year or your intern year is going to be spent entirely on the pediatric side at Cincinnati Children's, where you're basically doing the same intern year as every other one of the pediatric interns. And then between PGY2 and 5 years, you're basically about, since we're going to a 13 block schedule, you're going to flip back and forth about every 4 to 5 blocks. But in general, about every 4 months, you're going to go between the pediatrics rotations and then go back to the PM&R rotations. And that continues until you complete the program. So like I said, from a pediatric standpoint, you have the opportunity to rotate through pretty much any of the rotations that a pediatric resident would have the opportunity to. There's plenty of time for electives that you can sort of tailor what you think you might need as a pediatric physiatrist.
And about 5 minutes left.
Perfect. In terms of PM&R rotations, you're doing exactly the same thing for the most part as our adult residents. So all of those same rotations, you're going to do them as well. And then scattered amongst the years, you're going to get a total of 12 months of rehab rotations. And those are a combination of inpatient and outpatient. What I will say is we give you just one in your PGY2 year to remind you, you know, why you chose this program, and then sort of prorated where you're doing the vast majority of that in your PGY5 year. So that's kind of just a brief overview.
And I think that's about all we had. We do have a website, cincypmrresidence.com. This is where we are constantly updating information on the virtual recruitment season, opportunities to join our didactics. We've had several meet and greet sessions as well. These are our emails, my email, Dr. Bulger's email, and then Mary Duke is our program coordinator. So I think we want to just spend the last couple minutes to answer any questions.
The one thing I can put a plug in for, I also coordinate the medical students. So if anybody's interested in joining virtual didactics, you can just shoot me an email and I'll send you all the information. We're just getting ready to add some new dates and whatnot for the next month and a half. And then I saw something in the chat.
Yeah, let me see here. I just saw that too.
For students ineligible to rotate with you, how can we express interest or connect with your program? You mentioned a meet and greet.
Yeah.
So virtual didactics are one way to do that. Dr. Pager, do you want to talk about the meet and greet?
Yeah, I was just going to say that actually. So the virtual didactics, if you go to our website, it'll list, have a link to where you can sign up for our meet and greet, which is on, I think our next one is on September 10th, I want to say. I'm not positive on that date. I would check the website though.
Can you please, so Holly, can you please tell us more about outreach opportunities outside of working with medical students?
Maybe clarify the question. Like community service or, yeah, so as far as the next question, there is we do have faculty mentors. So all of our residents are assigned a faculty mentor once they start. So there is that option. And I would say in general, our program is very supportive of, like everyone's supportive of each other. So because it is so small, it feels sort of like a small family. And I think a lot of our senior residents and junior residents kind of naturally pair up as well.
So adaptive sports, I can take that one. We do. There's a variety of different things that you can get involved with if that's something that you're interested in. We've got, I mean, all the kind of classic wheelchair basketball type stuff. I feel like that's a really common one. There's also a wheelchair rugby team within the city that's pretty popular. And then there's a handful of other things on the ped side. We have a running club as well as some adaptive like bike training type things is the best way to describe it. But yeah, lots of different things. I even have a colleague that does some adaptive rock climbing, if I'm not mistaken, but I don't know much about that.
Yeah, and we have one of our current PGY3s is really into the adaptive sports, and she's actually done been involved with like adaptive skydiving and a lot of other like interesting things like that. She actually is interested in making the equipment for these sort of adaptive sports. So it's a unique interest.
One more minute left.
Any other questions?
And it looks like you've got the emails and the website there for everyone. So thanks so much for that excellent presentation.
Thank you. Thanks for having us, and thanks for
having us.
Great.